Welcome again. I'm Carlos Teixeira, and we are now live in our website, in our webinar, and starting the tactical design for pandemics. We are a class of students, master students and PhD from the Institute of Design located in Chicago. I want to give you a brief overview of what we have done, and then I'm going to pass to the team that has developed the work and the research to do the presentation. I just want to say that our plan for today is that for the next hour and a half is that we're going to be doing a brief presentation, and then we're going to open up for discussion. So we're going to open up for question and answers, and we expect to have about a full hour where we can be entertaining questions and a discussion with everybody that is participating. I'm just looking here at the roster with participation. In addition to the class that is consisted of about 16 students, I'm seeing a list of about 130 participants now on the webinar. So very excited that everybody's participating, and welcome to the webinar. Let me give you some background and overview of the work that we are presenting here. At the Institute of Design, we have courses that they stand for 7 weeks. So we call those seminars. And we were starting our seminar on strategy for open innovation, which is a regular course that the students learn about the role of design in developing open innovation. And this was starting in the end of March, but what happened was the pandemic, and then the decisions of shutting down the schools, especially the university, and moving everything online. So we are having two situations here. One was to rethink the course, but also at the same time, we are having a situation of unprecedented situation unfolding in front of us. And we decided that this should not be wasted as an opportunity for us to think in terms of the content of the course. So for me, instead of teaching the regular traditional strategies involving design and open innovation, I thought that was better if we transformed that into a research project that we were investigating the new strategies and new approaches that was going to emerge given the complexities of the pandemic. So what is the role of design in open innovation, given the new circumstance that we are experiencing and seeing unfolding in front of us? So that was the driver that made us think differently and approach the course differently. We shifted gears very quickly to be able to develop this course. And so we decided to do a real-time case study around the world about the tactics that design was taking and using for addressing the problems emerging from the pandemics. The students and the presentation today will give you more clarity and details, but that was the shift that we decided to do. So I want to introduce you a few people here. One of them is Azra. So Azra Sungo, she's a PhD student, and she is also the teaching assistant in this course, and she's leading this research project that we ended up developing. So she will also continue the research. This is a project that we're going to continue throughout the summer. And I say summer is the months of June, July, and August here in the United States. And she will continue this research. So thank you, Azra, for leading the project, and she will be talking at the end. We also develop a collaboration with André Nogueira, and I'm looking for André to join the panel. I haven't seen him yet, but he's going to be joining the panel. André Nogueira is a graduate from the PhD program in December, and he, after graduating here, he went to the Harvard School of Public Health, and he's associate researcher. So very interesting timing that he just moved it from our program, and before the pandemic started, he moved it to the School of Public Health at Harvard. And so when the pandemic started, and this project was, I was imagining this project, I decided that it was nice to join forces and bring André in and be able to collaborate with us, talking about the project and connecting to the experts on public health. So André Nogueira also joined it, and we continue our partnerships and collaboration, and this will continue also after that. But I also want to present to you, you can see as panelists here in the webinar, we had 16 students that composed our class, and they're all master level students, and they were the one conducting the research. Luckily, we have students from around the world, so when we are developing our research, we could look at the global scale and the specific context in which that was unfolding in this study. So thank you all the students. Some of them will be presenting the work here, but I want to congratulate and welcome them to our webinar here today. So the last comment here in terms of the background is the goal of this study is primarily for us to identify what kind of design strategies and tactical designs are being developed when confronting the pandemic. So we want to take them as case studies that we can use as a catalog of design approaches to pandemic. And we hope that this becomes a reference document for leaders in government, leaders, decision makers, and many other types of executives and strategies that are working on addressing the pandemic. So we think that in terms of government, in terms of also industry and education, so all the sectors, we imagine that people are confronting those challenges. And we hope that this is a catalog that can inform people in multiple areas how to think about the role that design can play on addressing public health. So that's kind of the general goal of our approach here. In terms of protocols of studying and moving forward with our work here, I'm going to move now to the presentation of the students presenting the work, 15 minutes presentation. We also have developed a report we are calling the catalog of our study. And you can look at the chat, and I'm going to ask Azra to put the link again. So if you go to the chat, you're going to be able to find the link, and that link will take you to the report, which is a PDF document that you can download. So at this moment, it's on a Google Drive, and you can download that. But later, we're going to have a fixed website that allows us to that will allow us to have a fixed address, and everybody can download this material. We're also going to put the video available for everybody, and then for people to view and participate in that discussion. So again, make available, make use of the report that is going to be downloaded, can be downloaded through the link that it's available on the chat. After the presentation of the students, we're going to open up, as I said, for question and answer. So we're going to have about a full hour that we want to engage the audience to have a discussion. And all the students in the class, myself, Azra, and Andrea, will also be engaged on discussing those issues, okay? If you want, you can continue to post your questions into the chat. So I will be monitoring the questions and then later kind of facilitating, moderating the discussions, okay? I can also move some of you into speaking and or even as a panelist and involve you in the discussion. So depending on how it goes, we will be facilitating the engagement of all the audience that is joining the webinar. So with that said, I just want to introduce again Andrea. Andrea, if you can say hi to the audience, and then I will introduce the panelists, sorry, the presenters for the project,
Hello, everybody. I am André Nogueira. I graduated from the Institute of Design last year with a PhD in integrating design, sustainability, and innovation. And then I moved to the School of Public Health in Harvard together with Patrick Whitney to bring design, in an effort to bring design to public health as a complementary approach to the public health field. I'm excited to be part of this. Carlos was my primary advisor at the Institute, and I am glad that this work continues to move forward and that it was able to be meaningful for the unusual times that we are all facing. So I'm glad to be involved, and I look forward to the conversation.
Thank you, Andrea. I'm going to pass now to the three presenters. So we have Pinake, Hong Piu, and Dimitri, the three students that will now lead the presentation. And after that, I will come back and facilitate and moderate the discussions. So please, the three of you can start now.
Hi, thanks for the introduction, Carlos. So let's start. So as mentioned, in response to this pandemic, our class, Strategies for Open Innovation, has worked together to put together a report of observations of many new interventions that are being developed across the world. And these interventions, they relied on existing infrastructures. And with that, they carry an unprecedented amount of complexity with resources, actors, and elements on every level. So for example, like with drive-through testing, we see people, places, and artifacts creating the need for design in each of these levels. So why does design matter? So even beyond the public health emergency, the pandemic, it's challenging the systems that we use in our everyday lives, from work to social life. We're witnessing the most trustable infrastructures falling short of addressing this challenge, a challenge that they were not designed for. We're now striving to redefine this new normal, and we have to redesign our daily life for pandemics to not happen again. And the main point is that very little attention has been given to infrastructures. We have been discussing policies, plans, and strategies, but we've been giving very little attention to how the things work and how they impact our available solutions to offer in times of a pandemic. So each of the artifacts, they need to be designed. In a case of a test kit, they need to be delivered to 7 million people on a periodic basis, and we need to design for every structural component of this intervention at an unprecedented scale. For this, we need to develop new tools. So moving on, unfolding of tactical design. Design is an integral part in dealing with pandemics because it involves all the design elements of our daily life in the ways that which all leaders and stakeholders are addressing. We conducted real-time research for a total of 60 design case studies in 5 focus areas as products, services, interaction, communication, and data ecologies. And we looked at variations in 4 different countries, the United States, Italy, China, and South Korea. So as mentioned before, we share the report in the chat section, so you can see the rest of the archetypes of the presentation in that final report. So talking about archetypes, we've analyzed infrastructures that are being deployed in the last 4 months, and we've deconstructed the interventions that are being deployed. For that, we've had to extract archetypes of these infrastructures through our analysis by defining an archetype as a transferable core logic of design solution defined by its goals, features, and affordances, meaning the actions that it enables us to take, basically. So with these identified archetypes that we've developed, we've considered our assumptions, which are embedded in these archetypes. We're not promoting these ideas, rather making us all aware of them and their challenges and limitations. The goal of this is to open up discussion. So let's start with the interactions team, identifying the drive-through testing archetype. So to begin with this case, more prevalent so in South Korea, that's where we've identified it as a case study, because of the need for rapid widespread testing. So roadside, vacant, unused parking lots can be described as doctors in protective suits and goggles taking drivers' temperatures with an infrared thermometer and giving a questionnaire to fill out. If you're running a fever and in the doctor's opinion, you may be at risk based on where you've been or who you've contacted, you're eligible for a test. But in this case, only the driver is tested, the passengers are not. So these drive-through clinics are catching on, including in the United States, in states like Washington, New York, Connecticut, Colorado, being the first to adopt them. So we understand that this is an affordance available only to certain people. Like for example, if you own a car, if you have the time, and if you have insurance. So that's one way we can make use of that as a testing method. The data ecologies group identified contact tracing as a built archetype. So again, South Korea is a good example of this. They were able to flatten the curve without imposing the blunt instrument of a lockdown procedure, and this was achieved through a contact tracing strategy. After the 2015 MERS outbreak, South Korea developed new procedures and revised laws to enable more aggressive contact tracing. The government was basically given the ability to access citizens' credit cards, cell phone, GPS data, bank records, and a wide-ranging network of security cameras. So this also coupled with South Korea's effective testing program came at the cost of high-tech surveillance. During dangerous epidemics, authorities have warrantless access to private data, which will be an ongoing debate in countries with surveillance measures. Moving on, the services group, they identified remote patient monitoring. With opt-in remote patient monitoring services, think telemedicine, we may have digital health monitoring devices, like something for blood pressure, heart rate monitor, and other potential wearables and apps that connect you to a network of doctors. These doctors can access your readings from these devices remotely, monitor them, and suggest recommendations to the patients. This means that appointment costs will reduce significantly, but the patient would relinquish much of their privacy along with the need to purchase these additional devices, which will cause accessibility challenges because of the cost barriers. So with these 4 identified archetypes, I give the floor to Pinaki.
Thanks, Dimitri, for introducing us to the concept of archetypes and the role that they play currently. So infrastructures being developed for public health are not limited to a single design solution. The infrastructures for pandemics mapped in the study are composed of a combination of possible and complementary solutions. These combinatorial possibilities provide the flexibility for envisioning inclusive infrastructures capable of addressing diversity. However, they require design ingenuity for seamless integration of different infrastructural components. Consequently, they form entrepreneurial ecosystems composed by different organizations and stakeholders necessary to collaboratively design a well-integrated system of design solutions. The study identified 5 different plans of combinatorial possibilities to products, services, interaction, communication, and data ecologies. In our case, what we learned was that these archetypes can be combined for integrating system solutions. We identified the features and affordances of each archetype as they enable us to take specific actions. Combinatorial possibilities is based on the idea that combining the affordances of archetypes can open up new flows and interactions. These combinations often require new actors to bridge the gap between the ecosystem that support each other. We identified 5 combinatorial possibilities based on our analysis of archetypes, and we will now share 2 examples of combinatorial possibilities that we discovered. For the remaining examples, you can all refer to the report that's shared in the chat. So on the services front, we explored 2 existing services, food and grocery delivery services and the public transit service. These 2 services combined together presented the possibility to leverage the mobility and efficiency of public transit and the convenience and flexibility of grocery delivery services. The next example, several plans have been proposed to deal with public health. Famous economist Paul Romer proposed a plan that focuses on frequent testing for mass population. Every 2 weeks, every single person in America. The combinatorial possibility that you see on your screen right now proposes to leverage existing networks to make testing available at a mass level. It involves 3 stages: pre-testing, what needs to be done to prepare, the test itself, emphasizing the need to establish a network, and post-testing, how people will be treated. This way, even if there are false negatives in post-testing, the next 2 week cycle would supply users with another test to reduce the chance of false negatives.
Okay, thank you, Pinaki. This is about our learnings. Our world is going through a major transformation, and the impact of our responses depends on our collective capacity to capture emerging solutions and also our ability to transfer them across context. It is crucial that we think of what are the infrastructure at our disposal to make the best use of our resources. It's a design activity to create different combination of the archetype of the infrastructure and their adaptation to variety of needs, can leverage our global capacity to respond to pandemics. Next, please. And the most importantly, that during the pandemic, we are dealing with unprecedented diversity and needs for equitable strategy. There are multiple variations of the demands out there. What we saw here is multiple variations of archetypes, but many of them are not yet enough in addressing this diversity. By tactile design, as you see at the bottom of this slide, we are not proposing a silver bullet solution, but variations of portfolio of archetypes can help address multiple variation of demands. And we can tell the more diversity we face, the more design we need. Andrea, next please.
Thank you. So the way that we are looking at infrastructures here, it's more from a relational perspective than actually the common understanding as it relates to the physical elements or that we know, like roads or water pipes, or these are also part, but we're looking at infrastructure more from a an integration of different components that allows us to take the collective to take actions based on their own interests. So what I mean by that is infrastructures are a combination of elements in relation to what these elements become an infrastructure. So I think that that's part of what we are exploring in here. It's understanding there are different components that have been designed and created that combine, they form an infrastructure that allows to create large-scale interventions and large-scale change. But when designing and understanding the interconnectivity between these different components, it's important to understand how they use and how their interconnectivity mobilize different types of resources. And here we present some of the considerations that we want to discuss when we bring these infrastructures or we give shape to these components and integrate them into infrastructures as it relates to the flows of these resources. Right, so understanding how resources are flowing within organizational levels and organizational structures, how are resources going, from top down, bottom up? Are they changing because we have a new technology and new operation at the middle level? How are these interventions actually supporting that change? So understanding and recognizing that different types of knowledge that are embedded into those different levels of organizations would then need to be accounted for when creating those interventions. So you cannot operate only specifically at the policy level without recognizing what is actually happening on the ground. That's something that we've been discussing a lot lately in the policy realm, in public health, as well as here. When we are looking at the integration of multiple systems, right? So it's breaking a little bit that focus on efficiency of single systems. So understanding issues from a public health system, or from a mobility system, or from a food system, but actually understanding that in reality those different elements come together. So are infrastructures. So it's understanding how our infrastructures are then allowing us to interconnect and dependent on the interconnectivity between these systems if we are looking at new tactics that improve the health of the public. Then understanding that a key point that will determine how resources are mobilized, or the dynamics or the change, are the interactions between the different people there, or the different entities that are part of this, right? So it's interactions between people and organizations and the natural environment, people and elements of natural environment. So we see that the things that we design, the portfolio of components, or the archetypes and the infrastructures that shape our livelihoods, are the things that actually determine how we interact with one another. Being a policy that prevents us to move in one direction and suggests that we move to the other, being a computer that allows us to interact in this way. So the interactions between those different agencies will determine the outcomes as well. And how things change and adapt over time based on what it exists. Therefore, we need to understand this adaptability of the infrastructures and the components in itself, but also how, when we have new players, we have what we call the property of an emergency, when we have new things coming up. And when they do that, we need to understand how do we respond to this and adapt to the course accordingly. So understanding how we design infrastructures that are more flexible and adaptable, understanding infrastructure from this relational perspective, allows us to combine the different elements that exist, as well as create new ones, as Carlos was talking about, this entrepreneurial ecosystem that is so needed in times like this. So I think that those are some considerations that we want to take. This is called the 4 Eyes model. So these are elements that I think that when we are looking at these things, is understanding how are resources flowing and being allocated, considering these 4 eyes points.
Thank you, Andrea. Yeah, this is Azra, and I will go on with the next directions that we will have in our research. So this preliminary exploration in the class with an amazing group of students showed us that our ability to deal with pandemics depends very strongly on the intelligent use of infrastructures and also seeding and making use of the combinatorial possibilities that we have between these infrastructures. And what is happening now is that we are at the beginning of a major transformation, and we will keep seeing a lot of new interventions unfold. And it's not a situation where we have a guiding principle that would fit for everyone, or that we have rules, or that we have even a satisfactory amount of certainty. So what we will see is probably the industries will take matters into their own hands and tactically develop new solutions to adapt to the changing circumstances. So we see right now that the workforce is changing, the logistics is changing, even our daily interactions are changing from every direction. So industries will need to adapt to these changes. So in summer 2020, in the coming months, we will be continuing this research, and we will be studying and analyzing this archetypes on an industry by industry basis. And some of the essential questions that we will be exploring relate to how tactical design can address the emerging imperatives in a changing world, imperatives that we see through the plans of think tanks, through the strategies of governments that will lead the path to a changing world. A second question is how can variations of these archetypes can support equitable and adaptable solutions, meaning how can we use this kind of methodology to address an unprecedented diversity that manifests itself in very varying needs in many different locations and communities. And the third essential question that we'll be addressing is how can industries can combine and apply solution archetypes to create new interventions. So how will the new entrepreneurial ecosystems will be unfolding? As we have been seeing in the past interventions, we have been crossing the sectorial boundaries, we have been crossing the national boundaries in the way that we transfer knowledge, information, and ways of doing. So one question that we're trying to address is how this is going to happen among industries and between the public and private sector. So this is the end of our presentation. I will give the word back to Carlos for the question and answer session.
Thank you, Azra. Thank you, Dimitri, Panikin, and Hongpyu. Great presentation. And so we're going to open now for question and answers. And what I want to do is to have really open conversation. It doesn't need to be just questions. If you want to pose, another thing that you can do is you can raise your hand through the tools of Zoom and the webinar, and I can move you to panelists, or I can just give you the opportunity to talk. And that allows you to engage in a conversation more than just just posting a question here. So we are also very open to hear about the challenge that people are facing around the world with that, and how our study can support or more clarification about that. I just want to reinforce what I mentioned, what Azra just mentioned, that our work, we are feeling that the next step that we need to progress our work here is that to move from a very generic strategic point of view of what are the tactical designs that we can use into very sectorial aspects. So how do we start thinking about mobility and how do we think about those tactical designs in the area of mobility? For example, the New York subway, for the first time in its full history, more than 100 years, has closed the train between 1 and 5 o'clock in the morning to clean and sanitize all the trains. So that's kind of unprecedented situation, and we're gonna see a lot of changes like that. Work environment, mobility. We were thinking about post-Roman kind of contact tracing example here as an interesting example to think about how universities would open up. Instead of thinking about the entire country, if you can kind of close to a certain region or a certain kind of community, maybe the contact tracing can be dealt in a very different way. So those are things that we imagine that once we start moving into the hospitality sector, or the mobility sector, the healthcare sector, all those things will have different configurations. So we're going to be conducting the study looking at those archetypes and those combinatorial possibilities as they will be applied for different sectors in the industry. So we're going to move more into industry and organizational focus, something that allows them to have more control and initiative towards using design in their challenges. With that, let me look at the chat here, and let me see questions that I'm looking at here. So let's take Tomoko's question to all the panelists. She's saying you can also look at the chat, but she's basically asking what characteristics, attributes would such infrastructures need to have in order to be adaptable, nimble, and flexible. So I'm gonna move to the panelists in the class for you guys to answer that question. And I'm gonna move Tomoko to a panelist so she can join the conversation. Anyone wants to jump on answering Tomoko's question? Tomoko, do you want to present your question or feedback on?
Sure, hold on a second. Sorry, I didn't have my camera on right. Let me turn that one on. Hi, everybody. Thanks for the wonderful presentation. I think this was amazing that you guys were able to accomplish so much in 7 weeks in a remote situation as well. I understand the challenges very greatly in accomplishing something like this. I just wanted to ask, so the idea of an infrastructure, you know, in order for it to be effective and work for the people that need to access them, there's a certain level of scale that needs to be accomplished, right? It has to be big. It has to be, you know, what we think of as traditional infrastructures like, you know, water, sewage, highways, right? They're at a certain scale. But, when new situations arise like this, I mean, looking at the cases that you guys have looked at, what made those new types of infrastructures that you mentioned be able to emerge so quickly, right? So that might be, and maybe it looks, looking a little bit deeper into what the affordances are, that might give us some clues as to what those characteristics might be as well. But I was just curious if you had come across your research, some ideas of characteristics or attributes that would allow infrastructures, effective infrastructures to emerge so quickly and be nimble and adaptive.
I think I can answer.
Okay.
Yep. So actually we studied about the different point of view of the infrastructure. Is a point of view of the citizen people, and as the workers in hospital, and also as a people in governor. But the one point we focused on was the citizens' point of view. As you mentioned about the infrastructure, it takes time to reach to all the service, the networks. So, but we luckily have already the online infrastructure, which could reach all the individuals. So through the online service, we thought about how we can communicate, how we can maximize to release people through understanding, knowing what could be the impact on their life. And we thought about how we can help them through the online. So we thought about the kind of online communication through the portals, and also the near future, they're thinking about the other new solutions such as VR, AR. And then we linked to other current infrastructure of the society. Each country has own the uniqueness of the social infrastructure. And then eventually we thought about what we could tactically combine together all the current the infrastructure. That was the way we approached for the pandemic. That's it.
Okay. So you relied on areas where there were already existing digital infrastructures for communicating and coordinating and presenting and promoting to people who need to use them. But I would imagine there's also the physical aspect of the world that things need to be put together, or they need to, you know, with the testing, how do you get the logistics aspect of moving physical things around to support the new infrastructures that are emerging too. But thank you.
Hi, this is Ananya. Can I just add to that? So one of the plans that was proposed was the Paul Romer plan, which is the Combinatorial Archetypes plan. I think that's a great example of how infrastructures need to be adaptive and extremely flexible. So the plan proposes that every 2 weeks, every single person in America needs to get tested. And the biggest critique of that plan is that there is no infrastructure in place to do that. And the kind of infrastructures that are being leveraged in order for that to happen are not necessarily healthcare infrastructures. They're using like university labs that have become safe testing centers. They're trying to learn from the Postal Service or census collection systems, so that how can we do like door-to-door testing. So I feel like in theory, it feels like a huge problem, but when we look at it in practice, we have to think in terms of what is the closest infrastructure that comes, that can help tackle this problem. So it doesn't necessarily have to be a healthcare infrastructure alone. There's so many other ecosystems that become combinations henceforth for a plan to come into play. This is a theoretical plan, so yeah.
And just to add to that, also talking about characteristics and attributes of infrastructures, Carlos had mentioned the New York subway system. So that's an infrastructure that it takes understanding of infrastructure, where we can identify different levers, where different levels of control can control the inputs and outputs. So if you're asking about what level of adaptability or nimbleness you can expect, it takes understanding infrastructure, but then also identifying those levers of control where you can make a difference. And that's where we identified that, you know, there were barriers to some infrastructures that we had existing where the effectiveness wasn't as great because maybe those levers might not have been utilized or not planned for. But in a way, it takes understanding an infrastructure, knowing where you can make change happen.
A last comment on that question is something that was of great concern of our work was also to, didn't come very clear in our report and our presentation yet, because we need to be more thoughtful and more rigorous on how we do this analysis. But one of the things that we are very mindful throughout the work is the notion of the bias that are embedded in all those solutions. We are very aware that all the solutions that are being done now, they are embedded and they are loaded with bias. One example is the drive-through. It just assumes that people can drive, okay? So that's a very basic and a very simple one. But it shows that there's a lot of basic assumptions when people are designing those infrastructures. We are not designing the solutions. We just did a mapping in a survey of the existing infrastructures, but we want to add the lenses of equity. That's one of the things that we have been very interested on looking, is how much those infrastructures are capable of dealing with diversity. So that's one of the simple thing about social distancing of people staying home, as we know, is something that it's very, for a group of people that is very privileged to be able for that kind of situation. So week by week, we're seeing kind of the shortfalls of many of those infrastructures. What you don't see here, for example, is an analysis of pros and cons of what worked or didn't work. We are just, it was so fast pacing that we are just mapping what was going on. But one of the things that we wanted to do in the study is to identify more, think about infrastructure more as components rather than a whole solution. Because what we started to see is that given the shortfalls of many solutions that have been implemented, people are adapting very quickly with alternative solutions. And which means they adapting the solutions in different ways. So instead of doing the drive-through, they are doing the contact tracing and creating a special task force that instead of people driving to the test goes to the people. So those are examples of, is about drive-to and not about drive-through. So those are examples of infrastructures that are being adapted on the fly, and we could see that week by week unfolding. So I just want to highlight that we're going to take a more extended and more rigorous work on analyzing and assessing the infrastructures from an equity point of view, given that there is so much bias involved on the solutions that are being used. Moving forward, I'm seeing several questions, and they are great questions, and we will be opening a lot of interesting discussions. I put Ricardo as someone that is a panelist. I know if Ricardo, you're there, if you can unmute and show up, and pose your question to the group, and I will let the students answer the question. Ricardo, are you there?
Yeah, can you hear me?
Yeah.
Yeah, okay. Okay, it's great to see the work at IIT and sort of look back to what you guys are doing. It's nice to be here. So I was just wondering about the word archetype. Like, I thought it was a curious word. So I have some references in mind, and I know different fields use the word in different ways too. So I was wondering if you could maybe talk a little bit about your understanding and meanings for this word.
I can answer that. So in the most, like, I have struggled with this word myself. It can have a lot of connotations, but I think the one that I understood best for my understanding was that think of it as a typical example, like the typicalness of anything. So we have these 4 countries that we studied. So what emerged as a typical example? What emerged as a commonality between all of these countries? So like, long answer short, just, yeah, that's how I understood it, is that it's the typical example of any given service or product. Does that make sense?
A typical example, is that what you're saying?
Yeah, like the typicalness is the key point here. If typical doesn't make sense, then think of it as the capstone example of any product or service. If anybody else wants to try and explain that.
Sure. Yeah. To add to that too, I think, well, the way I understood it as well is a pattern or a sequence that we can see kind of repeated. So overall, the pattern in testing as we were developing new methods, and what came out of it was drive-through testing was being utilized because of the opportunity that people had to make that happen. So we identified that as a pattern, also like an archetype as well. So that's part of that.
Specifically to this example or this case study, think of it as a Lego block. So think of it as a representative example of all the products and services. Carlos, one of the...
Yeah, thank you, Ricardo, for the question. And I think that the issue of the archetype was a critical thing for us in terms of, given the diversity of things that we're seeing, but we are seeing some patterns. So the challenge was, how do we report the specifics, but also how do we generalize some of the approaches that people are taking? So the archetype is this pattern that we can find that we can see replicated in multiple instances, in multiple variations. So in a very generic way, if I say cat, I think everybody has an archetype of what is a cat. And then you can imagine multiple types of cats. So archetypes, they give us a general understanding of the key properties of this thing, and allows us to see the multiple variations of that. So we are looking for that, given this is a global pandemic, but happening in multiple different ways and everybody approaching different ways. So we didn't want to take a full definition of this is a solution that was given in a place, but we wanted to see more, how can I say, specifics of components in this metaphor of the Lego. What are the components and how they have been combined? So archetypes are the building blocks of all the combinatorial possibilities that people are developing. And we wanted to use the focus on design to be able to focus on archetypes. That's why we selected products, services, communication, the interactions and data ecology. Those we thought that we consider the pillars, the key elements of design that were being used and developed in different ways around the world. So for example, a hashtag was something that was developed and used in communication, but they was used for different purposes in different locations in very different ways. But hashtag as an archetype is an example of a solution. Yeah. Okay, Ricardo, do you want to comment on that? Do you have more questions? By the way, very nice to see you.
Yes, I'm following your emails. Yeah, no, I'm glad to be here and appreciate the work. Yeah, thank you.
Carlos, in addition to your comment about our assumptions in response to Tomoko's question, there have been a couple of questions around why we left out countries such as India or Brazil, for that matter, where the socioeconomic status is not, or the socioeconomics status is not the same as maybe some of these other developed countries. Would you like to comment on that?
I will comment, and I would like you guys also to comment, because we have many students from around the world, especially from India, and also the ones from China can also comment on that. And we have also from Brazil. I'm originally from Brazil. So the short answer for that, it was by the time that we were starting the class, India was starting the shutdown. So we, and also we were looking for, I will explain more of that, but we were looking for case studies that has been already developed. So we were mapping things. In that sense, we had South Korea that has already gone through that process, China and Italy. And then the United States was unfolding. So we thought that the 7 weeks was a perfect timing to observe here in the United States. So there are a combination of two things. One is the fact that we have limited resources. We decided to look at 4 countries. If you think about 5 archetypes in 4 countries, and each archetype has 3 aspects of that. In week 2 of the class, we're already mapping 60 case studies, just for you guys to have a magnitude of that. So in the beginning of the class, we made a decision of not going beyond what we could handle. And we make an executive decision of let's hold on that. And that's why we continue during the summer, because we're gonna go back and visit case studies from many different other locations. So for example, the same way that we should look at India, one of the things that was unfolding during our study was to see what was happening in Germany. Germany emerged as a very successful story of controlling the virus and the pandemic. And there is very little stories about Germany. Germany is not on the news very often, but if we need to take a look on that, because exactly because it's not on the news, it's because it was very successful. So this was the choices that we have to make at the time. But I'm gonna let some of the students, both from China, that we had at least 3 months that things has happened there to use as a reference, and the students from India that was also doing the study and seeing that unfolding. Because one of the things that we discovered was interesting, that we're discussing the class, like this is happening right now in this place, but we are not documenting in our work. So please, students, both from China and India, if you can jump a little bit and comment, and also from Brazil, in this case, André, can jump and comment a little bit on those developments.
One of the things that I want to add to that, Carlos, and to everybody who's attending today, is that the whole point of this class was to, one of the points of this class was to put together a catalog of archetypes that everybody can look to, regardless of whether they've already adopted these archetypes or these solutions at all. And it's for them to come up, look at these archetypes and look to the concept of combinatorial innovation and come up with maybe solutions that are better suited for that country or for that socioeconomic level. Anyone else?
I can add to this. I think that there is an element here where the archetypes and the cases presented here, they're an example of a logic behind which we can start to explore and understand these infrastructural problems and large scale issues, right? I think that there are questions here related to different political systems. So how do we deal with in countries where governance systems are very much centralized, when there's corruptions, when there's none. And I think that here, obviously we'll have different combinations of different things. There are common elements related to this, like access to healthcare, access to medications, and etc. But there is a logic behind here, which is what the report brings about and communicates and presents just an entry point to start to unfold this discussion, right? As Carlos mentioned, this was an early exploration within 7 classes, and I think that provides a seeding for us to start exploring and gives us a logic through which we can start expanding this discussion and to different geographies, to different levels, more focused on specific industries or more focused on specific geopolitical boundaries. It's a different way of engaging. I think that's where this comes from, and each one of them will have different challenges. whether this is by the scale of the population, by the density, by the access to some of the resources that might be limited in certain places. So there'll be different challenges, but the logic is I think that's one of the main points. There are many things that I could talk about Brazil, but I think that I'll leave that to if people want to engage in this conversation more aside.
But one more comment on that notion of the different contexts, so different countries, different contexts. That for us, being able to compare to different locations and seeing how they were unfolding, that was the proof that the concept of archetypes was a very interesting approach. So a lot of the methodology that we developed in this case study to think about design in this pandemic, we were exploring on the fly. We were creating on the fly. So we appropriated a lot of things that we have worked at already. But for example, we were constantly monitoring what was going on in India, for example, and saying if the archetype that was used in South Korea now is applicable to another context. Just to use the example of the drive-through is an interesting archetype, but we could not find any example of that happening in Italy. And we're saying, oh, of course, it seems obvious, but let's map what are the reasons why this is happening. So this is an example of sometimes it might be obvious, but when you have the tools and the appropriate kind of concepts and frameworks, it becomes more clear the reason why things are happening the way that they are happening. Although many studies are not showing here about other countries, but there was kind of a huge flow of texts and articles and examples and links of things that were happening around the world that we were just kind of testing over and over the appropriate use of those archetypes that we were testing. So I have moved Mayank to panelists, and I remember that you have a question here, and because my connection just threw me off and I have to come back, so I lost your question in the chat. But Mayank, if you can unmute and interact with the panelists here, you are welcome to the discussion. Checking if Mayank, are you there? Okay, so moving on. Let me see. Is there, I'm also looking for the panelists. If you guys identify a question that you want to answer, please jump in.
Yeah, so we have a question here from Tiago that says, I'm just going to read out the question. It says, throughout your research, did you find any examples of organizations outside of the public health landscape, such as CPG or energy, appropriating or leveraging solutions designed to address public health needs effectively? Do you expect there may be models that come out of this pandemic situation that will address organizational challenges beyond public health?
Great. So I promoted Tiago to a panelist. Tiago, if you can introduce yourself so we know who we are talking to, and also gives more context for the students to be able to answer your question.
Thank you. Yeah, I think I know a few of the folks that are on this call. It was really great to see Tomoko on screen. It's been a while. Yeah, so I'm a former ID student. I work for Ernst & Young, EY. And we work with a lot of organizations across different industries, from healthcare, life sciences, through to oil and gas, energy, CPG, and technology. And so I was wondering if you, throughout your research, you've encountered any specific situations or any organizations that are leveraging similar models in ways to address their day-to-day work or how they deliver their products and services to their clients, as well as if you foresee any use of the models that are currently being developed by public health organizations involved in public health that might become interesting models for these organizations to adopt in the future.
So one of the examples that I can give in response to that, Tiago, is that some of the grocery delivery applications or grocery delivery stores are leveraging, like, and this is specifically in the US. I know for a fact that 7-Eleven leverages the delivery services of DoorDash and Postmates to sort of deliver orders that have been placed through their app. So there's a lot of this leveraging situation happening with grocery delivery right now. And a lot of this is keeping in mind or giving preference to our frontline workers right now. Does that sort of answer your question?
Yeah, absolutely. And well, I live in San Francisco, so that's part of our daily life here as well. Okay.
Can I just add to that? So this is Ananya. Again, like I feel like this question could be answered by looking back at the previous question as well. So the previous question was about like why we're not looking at countries like India. So one of the, obviously there was a logistical constraint of we could only pick 4 countries, but one of the things we learned from India was this urgent need to open up the economy because of such a large unorganized sector. While the pandemic is happening and the lockdown is being extended, there is this sense of urgency and there's a sense of immigrants moving back to the places they come from, etc. That's happening in countries like that. So one thing that we were able to study in this class as an archetype that could apply to that kind of a situation is mass testing. So we realized that if we're adapting to a model of mass testing, then is there a possibility that the economy can be reopened? So when we dove a little deeper, we realized that there needs to be some kind of prioritization that can happen in order for the economy to open. So for instance, initially, mass testing is very important for frontline workers because that's the kind of work that cannot be done sitting at home. So how do we prioritize those kind of workers? How can infrastructures be created so that those false negatives can be avoided and more people who are returning to work can actually be safer. So so one whole week we actually had a conversation about what this means for organizations, what this means for CEOs, and we think that mass testing or testing at scale, even at an organizational level, is a huge incentive for CEOs and leaders to get workers back to work. So we anticipate that there may be possibility of a model where organizational leaders are actually kind of paying for their workers who need to get back to work to get tested. And this is happening at a frequency such that people are safe and people can return to work. And even if it's happening every 2 weeks or whatever, but basically incentivizing organizational leaders to create a model to actually invest in testing for their employees.
I think this also moves to the next question. I move Ran as a panelist. And Ran, if you can jump in with your question.
Yeah, sure. So hi everybody. It's very great to listening to you what you have done. It's awesome, and I especially love the idea of like a combination combinatory possibilities of like the different archetypes and how their affordances sort of like match against each other. I was just wondering while you were describing this, right? Like I was thinking if I were an organization and I understand, of course, my archetypes and my affordances, how would I like, were there any guidelines for me to say self-evaluate and see what are some of the missing pieces, like what are some of the missing infrastructures in my organization that I need to potentially like put together to create the kind of to create like a broader ecosystem impact, or the kind of combined sorry, like the kind of two things combining together, the kind of possibilities.
Ron, do you mind introducing yourself just for us to
oh, yes.
to know?
Yeah. So I was also an IIT student. I'm currently working for BCG Platinum as a user researcher. Yep.
Thank you. So anyone wants to jump? I think that I wanted to bring that question because I think it relates to questions that we are talking about. The study that we're going to develop during the summer is related to how this will start to be more specific to industries and also to different companies and organizations. So how organizations now are going to start to look for that as their own tactics, their own strategies of dealing with those situations. Yeah, I'm just saying that part of that is going to be developed further during the summer, but I think we had a lot of interesting indications that throughout our study. But I will let the students jump in with things that they came across during their studies and from the different case studies that we did. Anyone? I'm gonna ask VB or Yoichi if you can talk about a little bit about antibiotics. I think that's an interesting example. We consider, for example, as one of the products archetypes was this notion of antibiotics. And this is an emerging area in design, the biotech. And designing antibiotics is a design process also, and has multiple implications in terms of what do we do once we have archetypes. So we are not in the science of developing archetypes, but we're in the design of designing, of creating archetypes, creating antibodies and using them. So VB and Yoichi, if you can comment on that, because I think this is a great example from a private sector lab-oriented of biotech solutions that are unfolding that represents a little bit of these questions about the role of organizations in the development of those solutions.
Hi, I'm Yoichi. Yes, yeah, so yeah, our team researched about antibody technology. And actually, at present, the antibody technology has not improved officially. But yeah, many companies, biotech companies or pharmaceutical companies are exploring the new technologies. And actually, yeah, this technology has a lot of advantages, yeah, compared to the vaccination. So, yeah, so our team are thinking, yeah, this solution, antibody solution, yeah, for example, using for testing and also using for research for the pandemic situation and also, of course, treatment. So, yeah, this antibody technology has a lot of potential to be utilized for many purposes. So it might be a mainstream in the following future. So, yeah, as for the related to the organization problem, yeah. Yeah, so I think that, yeah, many companies are doing a prototyping for now. And yeah, trying to identify the most effective antibody. So but it's still under development, and yeah, so.
Yeah, Azra, can you put the slides that we show one of the combinatorial possibilities? One of the things that I want to highlight here is the fact that, can we do the graphics so I can also show before? No. Yeah. So one of the things that is important for us to answer that question is also for us for people to understand that once we started to realize this notion of combinatorial possibilities, we also started to realize that there is a need for entrepreneurial ecosystems. So that's another conceptual, another concept that we explore in our work, is to understand that no organization alone is going to be able to do any of that. So our work was very much about open innovation. And we started to map exactly how each of those solutions, they will be those combinatorial possibilities, but combinatorial possibilities requires entire new arrangements of organizations collaborating to develop solutions. So the ecosystem that of the stakeholders and organizations that will be working together will require, one, the type of collaboration, but also requires some entrepreneurship. Entrepreneurship towards implementing those new initiatives. So that's why we have this term that you can see in the graphics that is about not only the archetype and the combination that we can provide, that we can bundle them, but also what is the actors and the ecosystem of actors, existing and new ones that will have to come together and to do that. Just to give an example, I don't know if people have followed the news in terms of the American sports leagues. One of the discussions that have been floating out is that Las Vegas, that is now being severely hit because of tourists and the social distancing and the lockdown, is proposing that the different sport leagues, they all move and they all get locked down in Las Vegas. So for example, they can get entire blocks of the city with 3 mega hotels, all 3 mega interconnected hotels, and do a lockdown. So all the press, all the athletes, all the executives, everybody involved in the league will be in that quarantine for the period of the league. So they can train every day, they can do the games, everything's gonna be broadcast through the TV, but everybody's locked down there. So this is an example of entrepreneurial ecosystem where the hotels and hospitality industry in Las Vegas is working with the sport leagues, with the TV broadcasts. So everybody has to adapt and completely change the way that they were doing things. So it's not that one organization is going to develop the breakthrough solution. It's not about the vaccine. It's more about those combinatorial possibilities where multiple stakeholders, multiple actors are going to come together to collaborate and develop an entire new ecosystem around those solutions. So keep in mind that this was one of the key findings that we were seeing of our work, is that organizations are going to have to reinvent the way that they go about developing innovation and using design to be able to develop the parts that is about their business, but the specific archetypes that's going to be plugging in, the specific product service data that is going to be a component of an entire combinatorial possibility and a collaboration of seamlessly integrating all those things through entrepreneurial ecosystem.
Yeah. And can I add to that a little bit? I think that comes into the where we see this being a lot as asset and competency form. So what are the assets that existing organizations have that might be underutilized, and they can leverage them and create new forms of values by combining with other organizations that might have assets that they can't own or control. Nevertheless, they can be combined to add value to themselves and to society, or unfortunately, in some cases, the environment, hopefully more and more the environment as we move forward. So it's understanding that hotels chains, they have the asset of their manufactured assets, but they can't own or control what sports do, and they have been severely impacted by the drop of tourism, right? So then now, how do we then use that as a structure or as a value added to a new combinations that can be formed? But then how do we strategically understand who should we partner with, because there are many hotels chains around the world, right? So the abundance of possibilities is something that requires a strategy in a way that who do you connect with and why, and that's when competencies comes in as part of as an institutional asset. What are you credible for, reliable for? What can you bring to the table as a strategy to form new ways of creating value? And then to that part, I think that we've been talking some of the entrepreneurial ecosystems, but there's also the notion of to what end, and that brings the aspect of purpose and leadership in combining these assets. So what does it take to mobilize these organizations to understand and explore what are the opportunities for value creation, and then all the challenges that comes with leading towards a common purpose that was not necessarily tied to any of these organizations, but that they can actually be mobilized towards that common goal in a way that benefits themselves as well. I think that's...
And once again, I want to highlight the challenge of equity, addressing inclusion, diversity, that those entrepreneurial ecosystems, sometimes they can be motivated to do the same and privilege the same. The pandemics is demonstrating vulnerabilities that we haven't considered before. So for example, pre-existing conditions is something that we identify that this is one of the drivers of death in the pandemic. And in Italy, it was more the vulnerable population with pre-existing condition, was the elderly, the seniors. When it arrived in the United States, it was people living under very poor conditions of pollution, nutrition, and also diabetes and obesity. So that's an example that things also have to be combined, and an ecosystem needs to emerge to be able to address this kind of diversity. So not just to do a different way the same thing, but also to address new demands that were not there before. So this is also an important mindset for all the organizations that we are learning here, that they are going to have to dramatically change to be able to address those new demands. Yeah. I'm going to entertain the last question. We are reaching to the time of the end, but I have moved Mohammed to be a panelist. And Mohammed, you also have a question that you wanted to address, and that it's talking about that the case study is looking for the future, which I think is a very interesting question. So, and Mohammed, from what I remember from our last interaction, you have been navigating between Africa and the Middle East, and which can add an interesting perspective into the conversation here. So checking, Mohammed, if you're still there, if you can unmute and tell us, introduce yourself and tell us more about your question, so we can entertain that discussion.
Hello, everyone. Thank you very much for having me. It has been a great interaction. My name is Muhammad. I work with Islamic Development Bank, which is a multilateral development institution. And we have been looking at vulnerable communities basically how we can be able to provide agricultural inputs and improve the farming conditions of farmers in Africa. So to my questions, I was wondering how Sweden, for example, is doing it. For example, in Sweden, there is no lockdown. However, there is someone that responded to that chat that in Sweden, in South Africa, it was the same case. There was no lockdown and they were able to do an extensive study in South Africa. But coming down to Africa, for example, Nigeria, I'm currently in Nigeria, by the way, there is lockdown, there is everything. But when you go out, it is as if there is no lockdown. When you go to isolation centers, you see people trying to break out. We have a lot of those cases, not only in Nigeria, in Kenya also, and as in many other African countries, you see people breaking out of isolation centers. People don't believe, this pandemic is even existing. The acceptance is a problem. We have problem of ignorance now in African countries and many developing economies. Why? Because many people, as in America and other parts of the world, you have to go out before you can be able to make a living, before you can put on the table. That is the case. So if you weigh the options, staying at home, you even die faster than going out to meet the coronavirus. So those are the kind of complexities we have in the developing countries. So that was one of the things I was thinking about, and looking at Sweden with all the technology and economies and technological breakthrough, they are not locking down. So that is the perspective I'm about to bring. I've been following with the New York, where people are protesting, they want to come out, and the governor is really in the media. So that's it. Thank you very much for having me once again. Thank you, Carlos. Good to see you again.
Thank you, Mohammed. I think this is an important topic that brings to the forefront the issue of communication. I think it has a lot to do with information misinformation or disinformation. And I think that we also see that every different context things are happening in different ways. So there's a lot also the trust in the government or not, and what the government informs or what different experts inform or not. So I'm gonna let the team from communication that has worked on this issue of media, communication, information to talk a little bit about the case studies that they developed. For example, the hashtag in China or other examples that they have developed. So please, the team from communication, if you can jump and give some comments and insights given the observations from Mohammed, which are very relevant and very unique. Anyone from the communication team, please?
This is Vivian. So we are working on specifically the communication media part of the epidemic, and during the case study of hashtag, we just found that different dynamics of the countries will influence how the people will use hashtag to discuss these things. So basically, for example, in the States, when people are discussing epidemic, they will use hashtag to record their own life and to share good news or information by the institutions and organizations. And however, in countries like China and Korea, a lot of hashtag is to raise the public attention to certain issues that has not been addressed properly or enough by the mass media. So this kind of notice is a very interesting dynamic differences between different countries, which we hope that can be an interesting finding to you as well.
Great, thank you. yes, we think that there is a lot design involving this part of information and how much we are learning. And this is also something that overlaps with the area of data ecologies, because a lot of information is based on the data, and you can see a lot of different use of data and kind of or constraining the access to data and things like that. The one thing that I also want to mention for all the group, something that we didn't show up here in this study, I'm saying that because of the communication issue, is that we also took a historical study of different moments of great disruption like this one. It didn't show up in this report, and we didn't have the time and opportunity to incorporate, but we look at the plague in the 1700 in Venice to see what archetypes were developed at that time and how they set up future directions. We also look at the Spanish flu in the beginning of the 20th century, and look in the patterns from that development. And I'm saying that because of communication. At that time of the Spanish flu, posters, if you think about the posters from the beginning of the 20th century, those are examples of classical designs that evolved, and posters were the main communication. And answering Muhammad's question, for example, in the Spanish flu, we learned that the daily newspapers, they emerged because there was a lack of communication about what was going on. At that time, there was not daily newspapers. There were just some publications and the printing press, but not the newspapers. And people are not trusting the government. Surprise, surprise, nobody was trusting the government at that time. So the only reliable source of information was the newspapers that didn't happen daily. But because the speed that the things were happening, similar to what is happening now, people needed instant information. So that's when newspapers started to develop every single day. And this was in Boston. Boston was the main center of the Spanish flu in the United States. And that's where the newspapers became daily and then expanded around the United States. That was the emergence of the daily newspapers that happened. So we did that study historically because it was also very informative. The third study that we did was about the Chicago fire, the Great Chicago Fire in the 19th century. And one of the big lessons to be learned from there, as we are discussing about privacy, it's interesting for us to think about privacy through time. One of the studies that we did was just to look at the smoke detector that most people have in your home around the world that emerged out of those major fires in London, in Chicago, and other urban centers. And today we are talking about privacy, like the contact tracing and privacy. But think about the smoke detector. It's detecting there is smoke in your home and is inside your home, and it's mandatory for you to have that. So that's just an example of sometimes we take for granted how things change because of those kind of major disasters or major disruptions. And smoke detectors at home, it's a question how much privacy people are going to start to have to give up their privacy or not, given the pandemic that is going on and the contact tracing that people are going to be willing to give up or not for be able to fight the pandemic. To fight the fire, we gave up the permission of having a smoke detector that it's linked to the fire department. So that's an example of looking from history of how things adapt and change. So I'm going to put a closure here. I have the note. I'm going to put a closure with the question from Andy that is talking about how will your target audience access this catalog. So we have put this link right now that you can download. Is in a Google Drive just for the presentation today. But we are going to put that back to, how can I say, we're going to put a page in our website. And this will allow people to, how can I say, to access that in a permanent link. We're going to put the video as well as the catalog there, and we're going to work through the summer. The way that we want to reach out to leaders and is that they can download. It's going to be accessible to the public. And we hope, not hope, but we plan to do another webinar by the end of our project in the summer. So around August, September, we're going to do another one updated and promote that, hoping that more leaders and decision makers, strategists will be policymakers will be looking at this material as they can inform their work. For now, that's what we have. That's what we have developed. And we hope that is useful. And we highly encourage people to use and engage with us on feedback on that material. So I'm going to put a closure. I want to thank everybody. A special thank for Azra for leading the project. I put her email address if people want to connect and give feedback and engage with us throughout the next phase of the project. Also special thanks for Andrea to connect us to people from the public health sector and for dedicating your time to help us on this project. And a special thanks for the students for the fantastic work that you guys have done. It was a challenge and was something that we have to build the airplane as we were flying. But I really admire the openness and eager to face the challenge and work through this work. Congratulations on the catalog that you guys have produced. I'm very proud of the work, and I hope that we are contributing somehow into the solutioning a lot of the challenges that we're facing with the pandemic. So feel free, everybody, to put a last note on the chat, but we're going to put a closure now. And thank you, everybody, and see you around.